So MPS VII, Sly Syndrome, is due to a deficiency in beta-glucuronidase, and that leads to accumulation of a variety of the glycosaminoglycans, dermatan sulfate, heparan sulfate, and chondroitin sulfate. Sly Syndrome has a spectrum of severity. On the one end, prenatally can present as non-immune hydrops fetalis, either in utero or at birth. And on the other end could be completely normal cognition and language and motor, but just simply have growth restriction and some of the skeletal findings. So that's a wide range. So in the when we're thinking about in the neonatal period or in the prenatal period, causes of non-immune hydrops fetalis, Sly syndrome, and other lysosomal storage disorders should be on the differential diagnosis, and point the maternal fetal medicine doctor or the GYN to refer to a geneticist for evaluation for Sly syndrome. At birth, if they survive that initial hydrops, which is characterized by anasarca, fluid overload, ascites, and could lead to fluid and electrolyte derangements in the first few months of life. There are children that can survive that transient period of that fluid overload and then go on to have the rest of the MPS features. Again, coarse facial features, an abnormal airway anatomy with narrowed and swollen soft tissue in the oropharynx. They can have recurrent ear infections leading to conductive and some degree of sensorineural hearing loss, requiring tubes. They can have varying degrees of the skeletal findings. The C-spine compression can happen early within infancy and in the early childhood years, so C-spine surveillance needs to occur early on. Later, they could develop the carpal tunnel or the compression neuropathy from gag deposition. And then the cognitive abilities do range from severe nonverbal to absolutely normal cognition. And so it needs to be on the radar for our pediatricians if there are some mild coarse features. MPS VII is more rare than the other MPS disorders, but fortunately we do have an intravenous enzyme replacement therapy called MPS VII, which is the recombinant form of beta-glucuronidase, and that is every other week infusion, and that has been shown to decrease the gag accumulation dramatically, and as we follow it forward, hopefully reduce some of the morbidity and mortality associated with Sly syndrome.